Gail Finn is a woman who's always prided herself on her appearance. But as she entered her 40s, there were changes she found less than appealing.
What bothered me the most was just around here.
Gail wanted a more contoured jawline and a younger-looking face and neck, but she couldn't afford to miss much time from work. So today she came to the Bala-Cynwyd office of Dr. Kirk Brandow for a procedure dubbed the 48-hour facelift.
The concept of the 48-hour facelift is to tighten the muscles in the neck, contour the jawline, and give a person a more youthful look that will allow them to go back to work quickly, usually within 48 to 72 hours.
Gail will be awake for the entire operation, which utilizes small incisions around the ears and under the chin. First, Dr. Brandow injects local anesthetic and extra solution similar to that used in liposuction for the body.
They have very minimal bruising because of some of the sophisticated techniques that we do with liposuction and with the anesthetics that we use that cause vasoconstriction to cut down on the bleeding.
Using a small tube called a cannula, Dr. Brandow removes excess fat from the chin and neck area. Then he makes a 1-inch incision by Gail's ear to start lifting the muscle underneath.
That's what this operation really does, is tightens the deeper muscle and soft tissue layers that attach to the jowl.
Dr. Brandow will stitch the muscle up near the ear and remove a small amount of excess skin. He'll do the same thing on the other side and finish with more liposuction to sculpt the neck and jawline. The 4-hour procedure costs $5,000, about half the price of a standard facelift operation. But Brandow reminds his patients not to expect a drastic change.
It's not a big facelift, and it's not for somebody who's 55 or 60 and who's looking to look 45 again. It's for someone who's in their 40s and wants to look as good as they can.
I'm not looking to transform myself into something that is something so different than what I am. That's not what it's about.
Now, as we mentioned, Dr. Brandow says 48 hours after the end of her procedure, Gail will be able to put on some makeup and head out in public. We'll check out her results after the weekend. I'm Anita Brickman, Channel 6 Action News.
And we invite you to join us Monday night at 11 for the results of the 48-hour facelift. Surgery. Well, Anita is here, and the big question is, was 48 hours enough for recovery?
And we shall see, Jim. Tonight, the results of a cosmetic procedure that promises a speedy recovery with little bruising and even smaller scars. But did the 48-hour facelift meet the expectations of the woman who went through it?
Gail Finn spent last Friday in the offices of plastic surgeon Kirk Brandow. She wasn't looking for a drastic transformation, just a firmer neck, a more contoured jawline, and fewer lines around her mouth. Dr. Brandow offered her a procedure dubbed the 48-hour facelift.
Most people will say that they have a busy business life, or they have a busy social life. They don't have a lot of downtime, and they're looking for just a minimal change that's not as big as a facelift, and they want to have a quick recovery.
And Gail was wide awake through it all. Using local anesthetic and small incisions at the ears and under the chin, Dr. Brandow combined liposuction with the tightening of underlying facial muscles to create a more youthful look. About 4 hours later, Gail was allowed to go home and told she'd have so little bruising she could be out in public after 48 hours.
This is going to be the greatest garage, isn't it, Sam?
Monday, this 40-something mom looked perfectly put together playing with her young son. Makeup and a turtleneck covered lingering signs of surgery. If today hadn't been a federal holiday, Gail says she would have had no problem returning to work after the weekend, and she was able to venture out 48 hours post-op as promised.
I am not in pain. I'm not in discomfort. I was able to shower and wash my hair and put on a little makeup, and out I go.
Dr. Brandow says compare that to the week of downtime typical of the traditional facelift, and you see why more patients want to try this less invasive procedure.
She'll look much, much better in about 5 or 6 days, but I think you'll see the biggest change will be in here.
I see a fresher look, absolutely.
Gail says she's very happy with the results, no matter how preliminary. Take a look for yourself, Gail before and Gail after. Dr. Brandow says she won't have to cover those small scars with her hair after 3 weeks, and after a couple of months, they should be almost invisible, all with only 1 day missed from work and no time away from her family.
I really did not hurt. I just felt a little swollen.
And in fact, her doctor says Gail has more swelling than other patients, and she's also experiencing some breakthrough bleeding near her stitches. To minimize such after effects, Dr. Brandow tells his patients to make sure they keep those surgical dressings on as long as recommended, and he also suggests taking an herb called arnica following the operation. It's a short one, but patients have to realize it is an operation, and you've got to follow the directions carefully.
But if this is sort of a mini facelift,
yes.
Does it come with a mini price tag?
A bit, yes. $5,000 versus
not so many.
Well, versus $10,000 to $12,000 for the standard facelift.
Half.
Half.
All right.
Half.
Okay. Thank you.
You're welcome, Jim.